Good morning, everyone. Good morning, everyone. I, Nikita Thakur, Department of Chemistry. I welcome you all on the day two at National Level Online Faculty Development Program organized by Sardar Patel College of Pharmacy and association with Gujarat Technological University on the topic Smart Research for the Digital Age Master in Grant Proposal, High Impact Scopus Publishing Patents and AI-Driven Excellence. Also, on behalf of SPCP College of Pharmacy, would like to welcome to the respected faculty, esteemed guests, and our participants on the second day of our faculty development program. Yesterday's session set the stage for an enriching experience. It was wonderful having Dr. B.K. Moria sir, and sir has effectively outlined the research roadmap, emphasizing the importance of pinpointing key challenges, strategizing with clarity, and implementing with the meticulous attention to detail. And today we promises to be equally insightful with profound speaker Dr. Vandana Patravale ma'am. With discussion, we learn from each other and take back valuable knowledge to our institution. Today, we have an exciting lineup of sessions designed to enhance your teaching, research, and industry engagement skills. Let's build on the momentum from yesterday and make the most of this opportunity to learn, share, and network with fellow educators. So, now I would like to welcome Dr. Anu Sharma ma'am for the introductory speech.
Thank you, Nikita ma'am. Good morning, everyone. It is my great pleasure and honor to introduce you to Dr. Vandana Patravale ma'am. She is a renowned scientist and academician in the field of pharmaceutical science. She is having more than 30 years of experience in teaching and research, and she is currently working as an professor in pharmaceutics department and Institute of Chemical Technology in Mumbai, India. She is the fellow of Indian National Science Academy INSA and also the fellow of Indian National Academy of Engineering. And she has more than 200 publication in highly journal of reputed and more than 14,600 citations, and H index is 60 and I-10 index is 183. She has granted more than 30 patents and having two trademarks in his account and multiple technology transferred successfully delivered to the industry, including drug eluting stents which are now marketed in more than 65 countries. With over 30 years of teaching experience, she has contributed into the field of pharmaceutical science, especially in the field of nanotechnology based drug delivery system, in the field of medical devices, and in the treatment of cancer related disease, infectious disease, and neurological disease. She has received various national and international awards like Abdul Kalam technological fellowship, Baswe fellowship, and she has also get recognition from Bill and Melinda Gates Foundations. She is the convener of APTI Women Forum and president of CRS Indian chapter, vice president of Pediatric Medicine Healthcare Initiative. She is the associate editor of Journal of Drug Delivery Science and Technology, and also on the editorial board of various peer-reviewed journals. So she is actively collaborating with researchers as well as industries within the country and abroad. Also, she has completed various Indo-Japan, Indo-UKs and Indo-US projects, and currently in pipeline she is having the project grant from the US. So she has transferred more than 20 technologies to the industry. With these all these expertise having with ma'am, I heartily welcome you ma'am to enlighten our researchers and academicians with your expertise in your field. Thank you so much ma'am and welcomes you ma'am.
Thank you, Dr. Anu, for those kind words of introduction. And thanks to Dr. Samaresh also for inviting me to this FDP, which is being organized by Sardar Patel College of Pharmacy as well as GTU. I'll be sharing my slides. So please, if you could confirm, is it seen?
Yes, ma'am, it is visible.
Okay, so welcome, dear participants, my dear colleagues, on the topic Unlocking the Mysteries of Research Grant Writing. Now, we all know that, as a pharmaceutical teacher, it is our mandate now that we don't only sort of increase the knowledge domain of our students, but also for the sake of our country, we do good research and make our India proud. So today what I'll be doing is I was going through the topics which have been assigned to all and saw that what are research grants and the sources of research grants probably people are not covering. So I'll be doing this particular session in two different parts. One is to let you know what are the research grants available, and then of course how do you get these uh, research grants, but by writing in a compelling way. So we'll cover both these points. And what you can see in the background is, of course, our Institute of Chemical Technology, which is definitely a portal of excellence. We are in Mumbai, but we do have two campuses at Jalna and Bhubaneswar, and another one coming soon at Thane also. So before we start with the sources of grants, we should know for what are we writing grants? Is it just to procure some grant for doing minor or major research project? Is it nowadays, that B.Pharm graduates also have to do some grant, including, of course, masters also have to do project work. So is it for procurement of grant for them? Is it that we want to build infrastructure? Or moving ahead, once you have done a preliminary work, your prototype is ready, you have many prototypes in one particular field. For example, if you're working in neurodegenerative diseases, you have everything what is desired under infrastructure, but you like to go for center of excellence in the same area. So there are different grants for center of excellence. And of course, having done that, nowadays again it's mandated by Government of India, and you see that you do have incubation cells in all the universities now. That is to catch up with early ideas which students might have, and they would want to become entrepreneurs, so that these ideas can be translated into good products. So research grants could be for any of these. So we do get different levels of funding then. Grants are for research students, say B.Pharm, M.Pharm, PhD. After they finish that, grants are also available for postdoctoral opportunities. That's post-PhD. Now, these could be also faculty. Post-PhD students can also be faculty. So these are interchangeable grants. And then you have grants for institute level also. What is the source? You can get these from national bodies. And most of the times, what we tend to miss is we can get grants from international bodies too. So if you are trying really hard and not getting through, national bodies see that if you have a burning idea which definitely can be translated, idea which is novel, innovative, move towards international bodies. National grants could be from government sources, state government, central government. Now, for example, your GTU, I'm sure, state government body, but must be giving you some seed money to conduct grant. So same way you have from central government also many granting authorities, which we'll see in coming slides. As far as international bodies are concerned, besides these government and non-government grants which are there, you can also get grant from private sources. Like, for example, you do have Bill Melinda Gates organization giving you grants. So that is a huge opportunity which one should not miss. You can also have grants from within universities, and I'm really, it is pleasure to tell you that many universities here in India have started supporting their own faculty. So it is not only, university, even colleges have started supporting. Some seed money is being given. In fact, at ICT, we do have what is known as UDCity Alumni Association Fund. So imagine alumni are coming together and giving crores of funds. And that is why your alumni backup has to be very, very strong. Your networking with them has to be strong. Not only to take money, some alumni give the institution back by way of giving grants, and some by giving knowledge. Both are important. Some do hand holding. They have become really experts in their own field, so they would like to do hand holding. So please see that if your database is not really up to date about your alumni, first start doing that. These are some of the national funding agencies which give you grants. I'm sure pharma people have been applying to Department of Science and Technology, Department of Biotechnology, maybe even to Ministry of Science and Technology, but more often we don't see projects coming in this region. DRDO, which is a defense organization, defense R&D organization. So you can write projects with them, for them. Imagine how much benefit it would do to our country. Recently at our institute, we developed carbon nanotubes, and carbon nanotubes were made use of in the jackets, which army people wear, bulletproof jackets. So imagine what can be translated from, say, pharma to textile industry. Same way, pharma to dyes industry, pharma to food industry, cosmetic and all, of course, So you need to know your basics really well, and then definitely, you can do wonders. Another agency which people often miss is ICAR, which is agricultural research. Now imagine when you have to come up with natural pesticides, your cognosy knowledge can come to use. Your formulators can make control release pesticides. They can make those ingredients sprayed onto the crops which are not being washed up by rains or high amount of heat or anything. It could be the ground level also, not only the crops which you can be seen. If you need to do bioremediation, your technologies come useful. So why not work at multidisciplinary level and come up with ideas which can help all? And of course, Government of India, AERB, that's Atomic Energy Regulatory Board, also provides you grants. I've seen this particular agency will not differentiate whether you're coming from private schools, private pharmacy colleges, or whether you're coming from government agencies. All you have to do is you have to have one person from Atomic Energy Institute. Then be it in MAS, which is in Delhi, or it can be BARC, which is here in Mumbai, or even Radiation Medicine Center. So any such agency, one person you need to identify. They have to be co-PIs, co-principal investigators, and then you can write a project which definitely will benefit masses. So the list is really huge. You have many agencies which can give you grant. I can pass on this particular PowerPoint presentation to the organizers, which in turn can pass on to all the candidates who are attending it. So you just have to copy paste these links and you can see that innumerable grants are available. ICMR gives grant, DST gives grant, DST SERB. Nowadays, many people are getting grants from there. You have Sri Padmavati Venkateshwara Foundation also giving you grant. So there are some private grants too. Kare Trust, for example, Indoco Remedies has set up Kare Trust, which also gives you grant. Talking about international funding agencies, that's a place to go. In fact, your research would be known when you start collaborating with others outside your country. So you do have UK India Education and Research Initiative. So as the name itself suggests, this is a collaborative grant between UK and India. So they not only give you grant for, say, seminar conferences, for student exchange. Your student can go there and work. For example, my student gone there and worked for 3 months on a problem, which was PAT assisted scale up or using HME. And that product has gone to market. Here you are making a prototype at R&D level. There you can make up at industry level. Their students came and learned supercritical carbon dioxide assisted nanofabrication from us. So it's a student exchange program. Same way, the grant is available. So we had 3 PIs from ICT and we had 2 from University of Bradford at UK. And really the project took a very, very good shape. So that gives you, if products start rolling out in market, obviously the universities will come again and again to you, right? And you are known because basically then products get translated. You're known all over the world. You have Indo-US Science Technology Forum, like UK India, you have India US also. Again, we had availed this grant. Of course, this grant we had written it only for international conference where we had one coordinator from US and one coordinator from India, our own department. And they identified the speakers. We had a beautiful 3 days international conference. So sometimes no, you wonder why DST, ICMR, DBT are not replying. But if you have good ideas, I think these are the people to go to. DAD, for example, no, Indo-German, more than 3,000 fellowships are given every year from DAD. So if you know German language and if you have a German investigator as collaborator, you can write DAD grant. CEFIPRA is from France. Of course, you do have Welcome Grant, which is the best grant to get. Why it is the best grant? Because not only you do get consumables, contingency, etc. Institute gets funds. You do get a block grant every year for research. Every year, say getting say 15 lakhs per year for 5 years is a huge amount. And in addition, over and above the grant, the grantee, that is a person who's written it, also gets over and above the salary some perks. So that is really, really important. And I know many of the colleagues here at ICER, at NIRRH, who already got Welcome Grant. So Welcome Grant is, if you get that again, because it is being screened, not here in India, you are known by your work, not by where you work, which institute you work, or which university do you work, right? So your ideas are important and they recognize that. So there are some other grants which are listed on this particular slide. For example, you have Alexander von Humboldt Foundation. So again, one of our students, after completing PhD, he went on Humboldt grant to Germany. What is the advantage of this particular grant? Or grants which are international grant. Another advantage is that every year they have get together. And get together is networking get together, right? So you have now researchers all over the world coming under one roof, discussing what ideas they want to take forward. So it gives you real good avenue to partner with other universities from other parts of world. Bill and Melinda Gates Foundation, you may be spending maybe how many days writing proposals, but Bill and Melinda Gates Foundation, they expect only one para proposal from you. So a very, very brief proposal, very crisp proposal is expected. Of course, they look for whether what idea you are giving is going to benefits to society or not. Go to their site, see what kind of projects they have funded. Not only our lab was a beneficiary of a grant wherein we developed nasal vaccine, but my own student, PhD student, who later became the faculty, even he became the beneficiary of this Bill and Melinda Gates Foundation, where they talked about water purification. So whatever are the burning problems, if you can solve them, definitely they will be keen to support you. These are some more international grants, for example, BRICS, Brazil, Russia, India, China, South Africa. So if you have partner from any of these countries, you can write under BRICS. Indo-Japan Cooperative Science Program. I know of many people in chemistry who have really worked very hard with Japanese colleagues and come up with certain good therapeutic moieties. So you may not be having some facilities, you may have to be dependent on them, or they may not have some facilities, they are dependent on you. For example, they are very good in chemistry, but they came to us for making anti-malarial formulations. So same way, meaning obviously, how will you be known to them? That is through your research publications, through your research patents. In that regard, this FDP is going to really help you more than one ways. Grants continue. You have Indo-German calls, you have Indo-Russian calls, Belarus joint calls, Indo-Australian Biotech Fund, Norway joint research project. So these calls, if you keep your tabs of DST and DBT open every day and just check, every day newer and newer grants are being posted, because our country has good relations with almost all the countries abroad. Hamid Visiting Fellowship, if you know of Dr. Yusuf Hamid from SIPLA, in his name, fellowship has been created so the person can go to UK and work, because he had done his postgraduate studies there. In his name, fellowship has been instituted. Same way, there are certain awards like Rolex Award. When we say award money is always non-taxable. Your students might need some grants. So it could be for pursuing research, it could be for exchange programs, for travel, and so on. What are these grants? Look at n number of grants which are available. For those who are meritorious students, university rank 1, they get DST Inspire Fellowship. They have red carpet treatment even in university. So if Gujarat Technical University topper wants to come to ICT, they don't even have to clear ICT entrance exam. One interview would be taken to see their research aptitude, and that's all. Fulbright Nehru Fellowships. These are Indo-US. Welcome grant is Indo-UK. So students also have access to these grants. So they will not only be given travel to and fro, they'll be taken care of with respect to accommodation, they'll be given fellowship. Also, the visa fees covered, some medical expenses are covered. So all in all, everything for those students is covered under these grants. How many of you know that UGC has a girl child grant, single girl child? When you say single girl child, that child should not have any siblings. So women in particular, now you see in India, lot of schemes have come to promote them. And it is time that they are promoted so that women can go to leadership roles. Single girl child scheme also provides postgraduate students with funding over and above the funding which they might be getting. Most coveted fellowship is DST SERP CII. That's known as Prime Minister's Fellowship. In this case, one needs to identify industry partner. Industry partner roughly gives around 5 lakh rupees to CII, which is Confederation of Indian Industries. DST SERP puts in equivalent amount of money, and Prime Minister fellow gets around 93,000 rupees per month. Again, I repeat, 93,000 rupees per month, which many teachers are also not getting. And this is the money they get by doing their PhD. So again, our lab has been lucky because we have industrial connections and the projects keep coming in. One Prime Minister fellow goes, the other enters. So this is something which should be explored. So these are just a snapshot. For example, Inspire Fellowship, where I told you the eligibility is that one has to be rank holder, first rank, gold medalist from a university. These people, in fact, Inspire Fellows can do direct, B.Pharm to PhD integrated course. Not necessarily they do B.Pharm, then M.Pharm, and after 2 years of M.Pharm, they get PhD. Our university gives these fellows both the degrees. Because in India, still M.Pharm is required as a teaching eligibility. Eligibility criteria, PCI has not changed. So if you are direct PhD, they don't consider it. So therefore, 2 degrees have to be given. Otherwise, abroad, if they were to go, that degree is recognized. These are some other funding agencies which actually support all the students. For example, Newton Baba placement program. Typically, if you are in the 3rd year of your PhD, you can apply for this Newton Baba PhD placement program. So as you can see, it's written Indo-UK. So part of your work you can do in UK. So one of our students recently availed this Commonwealth Split Side Scholarship. So generally, if you are Inspire Fellows, they know that you are meritorious students. So you do have better chances of getting this. So Commonwealth Split Side Scholarship. So 2 years she worked in our institute. Last 2 years she worked in UK. Net result was, that Indian students work so hard and they are so intelligent that the student was offered postdoctoral fellowship in the same lab. If you have heard of Rayan Donnelly, who works on microneedles, the same lab she is offered PDF. Even before she completed PhD, she was offered and she's still there. So this is about Cefipra, as I told you, the snapshot. It is for the dedicated support to Indian and French students. Eligibility is ongoing PhD. For all these, it is eligibility is ongoing PhD because they are like sandwich programs, or you can say student exchange programs. But you need to apply 6 months prior. So keep that in mind that they support, but it is not that today you apply and tomorrow you'll get. So you need to keep 3 to 6 months backup. Best part is that all of these agencies, be it DAN, Newton Baba, Commonwealth, all the applications are online. So it is, if you keep all the paperwork ready and if your institute really supports you, because you need to give undertaking from the institute, this can be done. These are some of the links, for databases from where this was prepared. But what you can do is, in one place, if you want to know, what is happening, which particular grants are available, you can go to indiabiosciences.org and there you'll get to know all the grants which keep coming, so rather than opening 10 tabs every day, 1 tab is enough. And now I'm going to shift gears and move to proposal writing strategies. It is very, very important, as I told you, that your proposal, just like, you write a research paper and you have to be very careful, here also you need to be very, very careful. So first of all, you need to identify the need and generate focus. How will you do that? Identify which field of research you would want to work. Whether you want to submit research grant for generating proof of concept or it is at the advanced level. For example, you already have a prototype ready, you want to do clinical studies. So that should be very, very clear to you, because depending on that, you will get the budget. So if it is only at the ideation stage, budget is different. If it has gone to technology readiness level 4, budget is different. And if you are technology readiness level of 6, that budget is different. 6 and above, there's no ceiling. You can go up to 8 crores, which is a huge grant. But at ideation stage, if you start asking in crores, no one is going to give you. So at ideation stage, because that idea works or doesn't work, you don't. And in fact, Government of India has another grant. If you don't know your idea works or not, but you have some conviction that it might work, it's high risk, high award. But it has to be genuine. It has to be novel. Again, depending on this particular thing, your tenure will vary. Tenure meaning duration for which you are submitting the project. So if you are at ideation stage and you say that you will take 5 months, that's acceptable. But if you say you will take 5 years, that is unacceptable. So tenure, budget, POC all go hand in hand. And in general, I've seen that our Indian granting authorities, they would prefer if you collaborate. Collaborate with your colleagues inside the institute. You can collaborate outside the institutes, but best will be if you could collaborate. Many the private colleges say that uh, government grants really do not come easy for them. But then if you join hands with national universities, if you have a particular expertise and you are making use of their expertise, you can write joint projects. Who stops you? So that also needs to be considered. For writing a grant, your research hypothesis has to be very clear. Being evaluator of research grants, I've seen that many times a clear-cut idea is not given by the grant writer. If you are not clear, how will the students work and how will you get products which can be translated? So please work towards it. Don't write a vague hypothesis. It has to be a strong hypothesis. Ask questions which no one has asked before. Because the first thing which evaluator is going to do is put in the keywords and check whether someone else has done that work. If someone else has done that work, your chances are nil to get that project. So ask questions, I would say, which no one has asked. Try and answer those questions. That's your hypothesis. Availability of resources. Other thing which is generally seen is what facilities your institute has. If you already have 4 HPLC and you are still asking for another HPLC, they may not give you. So rather, in that case, ask for any other equipment or justify why 5th one is necessary. That also happens, ICT had many, but I had written a project where again I had asked for HPLC. Why? Because in our lab at that time, the research student crowd was number 24 and each one needed a HPLC. So even if I was working in shifts, I was not able to cater to all. So I justified and I got. So either give a strong justification or see that, you don't ask the same equipment or instrument. Need for manpower, very important. Randomly asking 2, 3 doesn't help. For example, I had written a vaccine project for DBT, during COVID time. And there we asked for, there were 3 institutes, our institute, another institute in Navi Mumbai, and the third institute, which it was not an institute, I would say industry, IBRI, at Bangalore. So obviously, Mumbai people can work together. So one manpower for us, one manpower for them. By not asking 3, what we could do is, ask for a lot more money in the consumables, which was the requirement. A same student could work in 2 places as far as Mumbai was concerned. For IVRI, another student. So that way we asked only for 2, though the project was written between 3 PIs. Other is, whether you need a JRF, SRF, or a postdoctoral fellow would be defined by what project you are writing. So you be very, very careful on that. For example, again during COVID time, we had written a project on diagnosis. So if you're writing for diagnosis, you know what was the urgency there. If I write a 3-year project, obviously I will not get. What was the need there is, can we very quickly come ahead? So it was a 4-month project. Just, whether you're getting or you're not getting, it is that. So for that, you don't have to write 3-year project. We had a technology which we wanted to test. So there I employed a postdoctoral fellow, someone who understands what is research. Then only they can do, within 3 months, the kind of research what I expected them to. Devise time-based goals. Many times what happens is, when the proposer writes a project, they write it for 10 objectives. None of the reviewers are of the opinion that you can accomplish 10 objectives. Rather, what I would suggest is, you group your objectives together. Don't ask research grant for more than 2 to 3 major objectives. Further, you can break down. No, you can break down. But while you're putting in the grant, let it be major 1 or 2 objectives. And then, of course, money would also depend on what are the projected outcome. They look at this very critically, what would be outcome of your projects. Earlier, government was not bothered, but now they time and again will ask you to present your work and see whether whatever deliverables you have written, the end of 1 month, the end of 18 months, 2 year, 3 year, whether you're meeting those deliverables. If you're not meeting what you have given at the end of first year, they will not give you a second year grant. So be very careful. Specifically, I'll tell you, be very careful for the first year, because we are over enthusiastic, right? But first year, you need to get the equipments, you need to get the students. Everything takes time. Install the equipments, do IQ, OQ, PQ, train the students. So 6 months will go in that itself. So rest the 6 months, what you can do, write deliverables accordingly. Then if you do more, they are happy. But if you put more and you do less, they will not give you grant. So be very careful on this aspect. Already we have talked about grants both from national and international. Now, how to select where to apply? That's a question. You need to be, as I told you, keep tabs open. There are some grants which are accepted throughout the years, and you should know that there are some grants for which there is a proposal call. So these grants, since there is a grant proposal call, they are processed faster. Because there's a committee which is set up. A committee will look to it that they complete their work in 3 months' time, so that at the end of 4 months, you get that proposal. So, but you should read that. Many times it becomes very helpful. For example, there's a grant proposal for sea buckthorn. Now, I didn't know what was C. Buckthorn, but I keep reading all the proposals so that my knowledge is increased. I checked, it was Leh berry, berries which are there in Leh Ladakh region. And it's a seasonal fruit. What happens is that seasonal fruit, at the most, they are making juice of it and then it goes waste. But if you see those people, they live longer. So when there was a call, I knew that my colleagues will write for anti-inflammatory because that's the first thing where they see, whenever there's a color compound, they see anti-inflammatory, antioxidant effect. I said, let me be different. I wrote a cosmeceutical proposal and it came through. So read what everyone else is reading, but judge what your reviewers would want to see. They'll like to see some project with a difference. And that project, I wrote it to the food colleague, Department of Food Technology. She standardized, did the proximate analysis. She looked at all the drying techniques, how the contents can be preserved. And after that, she gave me a powder, which I had to use it for cosmetic product, which was much, much better. That now later on, of course, when traveling, I saw that some products are available abroad for sea buckthorn, but not in India. And those products used to fade with time. Active was orange color berry, so that used to get degraded in presence of UV light. So we had a formula which protected that and gave us anti-aging effect. Now imagine anti-aging cosmeceuticals, how important they'll be. Easily any industry would pick it up and take it on shelf. Other thing is use keywords from the call itself. If you don't use those keywords, shortlisting might be difficult. So it's like, research grant, I always say it's like applying for a job. First, identify what they want and then design how you can offer those deliverables through your idea. Research stage, as I told you early, identify what is a research stage, whether you are at ideation stage, whether proof of concept, or whether you want to translate. Now, for example, we have now many technologies which we have proof of concept. So at this particular time, I am busy doing translation. And very glad to say that 24th translation just happened last week. 24th product from our lab has gone to industry last week. So that gives you leverage. So either you can give it to startups. You may get less money, but you are doing it for your country. I believe that's the way to go. You can do it for startups, you can do it for MSMEs, medium scale, or you can do for big pharma. Translation has to happen. That means you have to write project also with end goal in mind. Research should never be open-ended. I've synthesized some chemicals, I've tested it, and that's it. That is of no use. If you have tested and you've got activity in nanomolar, why don't you give it to formulation expert to formulate, who then will give it to their pharmacology colleagues who can actually evaluate, and why the product cannot be translated to industry then? Now that newer moieties are not coming in, chemical moieties are not coming in, right? That's why biological trends started. That's a different story altogether. But then we might be having many such moieties hidden in our thesis. So it's time that we work together and work for problems, which our country is facing. Do some socially relevant research. There's a Gyati grant, which is Gandhi Young Technology Innovation Grant. Every time we apply for it, we get it. But very sad to see not many entry. Now again, I'm on the other side. So not many pharmacy graduates are submitting this grant. And here, best part is that the money directly comes into students' account. Because it so happened initially it was coming to institutes. From institute, students were getting difficulty in getting that money. So now they are directly transferring that money, which is tune of some lakhs, right? 15 lakhs of rupees. And that can be definitely used for tackling socially relevant research. So here we had given one project on nano diagnostic kit. We had given one project on anti-AIDS, which is based on herbal moieties. And we also had given another one from nose to brain delivery for glioblastoma. All three projects came through because another thing is, of course, now they know that if something is developed, translation would be next. So they want that you do socially relevant research, not just for research namesake. Finally, these products have to roll out to market. How to start? Read the grants that are funded by agency in view. For example, I told you if you're going to apply for BMG grant, see whom have they given those grants and what are their expectations. All those details are there in the website itself. Same way, if DBT, DST, ICMR, all the grants, guidelines are given. So make a template outline, keep it ready. What happens is generally last date is April 30th. You will start working on April 15th. That doesn't work. Keep proposals ready whenever you have time and then fit those proposals to the grants when they are asked. When you're writing your proposal, what needs to be done? Be very specific. I've already told you, don't be vague. If you're beating around the bush, that doesn't work. Be very specific. If I want to make, say, nano technology, if you write, it's very broad. I want to make nanoparticles, that's also very broad. But if I say I want to make nanomicelles, that is specific. Nanomicelles for glioblastoma is a specific type. Nanotechnology to tackle brain neurodegenerative diseases or brain cancer is a vague title. So that way you need to be specific so that just by looking at the title, reviewer understands what to expect inside the project. Identify collaborators, though I've written here optional because many of the granting agencies don't exist. I feel that we should have good collaborators. It helps. For example, when we did anti-malarial work with DBT, the first question which I was asked, I had proposed nanostructured lipid carriers for anti-malarial dual drug combination. Now, evaluators sitting there had never heard about NLCs. They said, why are you not doing liposomes? Because liposomes are in the market. Had it been some other person, they would have probably changed said, okay, we'll work on liposomes. Said, liposomes have these problems. And my NLCs will overcome all these problems. So I want to work with a next generation lipid-based delivery system. So you can always defend because you know your proposal better than anyone else. And then I said, what would TIFR do? I said, TIFR has good facilities to evaluate. Animal experiments can be done there. Why not at ICT? ICT, because you need a segregated room here because it's a parasitic disease. Animals can get infected. We don't have. So I had to be ready with those answers. Best part of this was that when we presented first year data, I asked for more money. First, first meeting, they were not ready to give us 1 crore, right? But they gave because they understood that there is a need and we know what we are doing. They gave us 1 crore. But the year one ends and I asked for more money. But looking at the progress of the work, they gave more money. So original project cost was about 90 lakhs. Finally, we got more than 1.6 crores. So know your audience. It's very important. When I say know your audience, it is who is going to evaluate your project. Not who the person, but in general, it goes to, pure science people. Very few are technocrats, right? It doesn't go to industry at all. So you need to mold your language so that they understand it well. You need to, many a time, simplify your language. Don't use decorative language. And now, Chat GPT language, do not use at all. That's the first thing they will check, and they will know that it is assisted by AI. Your intelligence gets marred there. Why I'm saying that? Because the moment you put your idea in the Chat GPT, it is permanently gone. You will not be able to patent that idea. Because anyone else put in the keywords, he or she is going to get that idea. So do not make use of Chat GPT where it's not necessary, or for that matter, any other such tools. Be up to date. When you're writing your proposal, your references should be till 2025. You're submitting in 2025. You can't give references. No, many times what happens is some proposal comes to you, you evaluate for whatever reasons it comes to you, and then you modify and give the same references. Don't do that. It has to be up to date. And in fact, we expect, the reviewer end expect, that last 5-year literature, whatever is there, that's given. And see that you follow guidelines. No, they give you word limit. So you cannot, if they've written 500 words, you can't put in 1,000, because rest the 500 words will not be seen by the reviewer. You need to organize your proposal really, really well. So obviously, the summary is nothing but the abstract, which you will be writing last. Just like in research paper, after you write full paper, you write summary so that you don't miss anything. This has to be very crisp, right? The summary in 1 or 2 lines. What is a problem statement? Why it has to be done? How it has to be done? And what do you expect? Everything has to be in the summary. So it goes like this, no problem statement. Some proposals put it as problem statement, some will put it as methodology, hypothesis. Then you need to give literature review. Literature review, not only research, also patents. Many people miss that part. See that patent review is also there. Literature, I already have told you, recent references have to be there. Methodology, there's no limit of words. So you need to write this in detail. People need to understand what exactly are you going to do and how you are going to do. So unless you are clear, you cannot convey it to them. So spend time and do this very well. Just saying particle size by zeta sizer doesn't help. How exactly? You know that zeta sizer gives you hydrated diameter, right? So you need to be careful. Like example, I told you of micelles, right? Micelles, if you determine using zeta sizer, size will be different. And if you do it using small angle neutron scattering, size will be different. So you need to do double check. So that you'll have to justify in the methodology itself. Then who are the people required? What would be their qualification? What level do you want them to be? Are masters okay or PhDs okay? Or you need postdoctoral fellows, or you don't need any of them and you need only a lab attendant. Justify. Whatever you're asking, you justify. That is what is important. Starting from title, it has to be simple and original, yet catchy. As I've already given you example, it has to be specific. So again, writing, long 4-line titles are not going to help you, because that's going to confuse the reviewer. That's why I said simple and original. It is not English skill which they are evaluating, right? But at the same time, they are evaluating what that project means to you. Whether you've understood what you're going to do. In the backup techniques and the alternate techniques, you will give what, for example, I told you nanomycels for glioblastoma. If they fail, maybe you will do something else. Maybe you will do cubosomes. That will be an alternate technology, right? But they want to know whether you know your stuff. Follow character limit. Again, for title also, generally there is character limit. Therefore, I told you, don't write 3-line, 4-line titles. They are of no use. A great title captures the evaluator's attention with its uniqueness. See that. You keep it unique and yet it has to be simple. I told you project summary or abstract. Some places comes as origin of proposal. All are one and the same thing. Just like title, this also gives first impression for preliminary screening. Many times they'll read the abstract, just like in research papers, no? Many times you read the abstract, don't find it good, you don't go further. Same thing reviewers are going to do. If they don't find this as some application, it has some novelty, they are not going to go further. So make first impression using this summary. And therefore, I told you, you write that last, spend some time writing it, and let that be really very succinct and specific. This should lay a very strong framework via preliminary work. Generally, project proposals which give preliminary work undertaken have more chances to get accepted because they know that you've done something, you're getting something positive. Highlight the need, the approach, the methodology, the outcomes, everything in project summary. And obviously, use relevant keywords. As I told you earlier, use keywords from the proposal. That has more chances to go ahead. For problem statement, you need to show the purpose of doing this particular research. Why there is a need. What is that unmet need which you are going to basically tackle? See, it's written, convincing rationale you have to give. Unmet need. So under this unmet need, which objectives are you tackling? Give background of those. Highlight the novelty. So you need to show if there is an unmet need, your expertise, how can you meet and tackle that unmet need? So how will you give your expertise? Obviously, you will give your own publication references. You'll give your own patents and convince them that I worked in this area. So, for example, you're writing it for neurodegenerative diseases and you have expertise in cancer. You can show that I worked, say, in nanotechnology in cancer. The formulation techniques are going to remain same. And I believe excipients are also the same. So, I believe that this will have utility value for neurodegenerative. So, connect the dots. That is what is very, very important here. Literature survey, I've told you last 5 years of research. Don't forget the patents. Market scenario. If you can have your friends, in industry and they can do this for you. Of course, from literature, you'll know what is a market scenario, but sometimes you do not get the real statistics. So if you can get these real statistics from them, it would be of help. Be selective and critical. Now, this is very important. What am I trying to say? Be selective. Obviously, for last 5 years, not that this work has been done by person X and I delete that person X's reference. Never ever do that. Okay, you can give that reference and say how you are different than that person. What difference you are going to make, what methodology which you are going to use will be different than that person. So it's very important. So basically, this is just like, if you've written patents, they ask questions. Differentiate, how do you differ from these patents. So same way, give references and say that how your hypothesis towards this particular goal is different than those references. Follow consistent reference style. This puts all the evaluators off. Somewhere they use all authors' name first, somewhere they'll just give the reference, somewhere some other style. So keep that reference style same throughout your project. And of course, reviewers want to know if necessary preliminary work has been done by. A best example is this particular proposal, where you can understand how the proposal has to be written. High risk, high reward. So they ask for origin of proposal. In origin, what is expected? Scientific rationale for doing this work. What are the risk elements and rewards? So this is, of course, applicable to this project, but in your project also, you can indicate that if you do this, what are the expected rewards, right? Whether you'll be able to get translational product, stable product, cost-effective product, or you will develop holistic scientists, all of that has to come. Review of status of research and development, the subject, so international. See here, it's written a correct and faithful description of international research status must be given, because authorities have realized that people are playing really, they feel that evaluators are fools. They do their own search. So if you've taken it from some person who's doing very well internationally, the idea you've taken from him, give recognition to that person. And then say how you will be different, right? As I told you earlier. Same way, national status needs to be covered. What then is, if you have given international status, national status, give what is importance of your project in context of current status, meaning what was that gap which existed? What is that new area which you are going to tackle, which has not been earlier done? Sorry. If the project is location specific, indicate why it is location specific. Maybe some work you want to do, suppose in Orissa, Bihar, where there is Kala Azar. Then you should be able to give statistics. Why I want to restrict it to Bihar or Orissa and not in Mumbai or not in Ahmedabad for that matter. Just give me a second. Methodology, it has to be very clear, focused. You need to give realistic objectives. Also give details of how each objective will be assessed now. So that means give most suited methodology. Also go on giving alternate options. Wherever you are not sure, give alternate options. So they know if plan A fails, plan B is in place. Project doesn't stop. Justify past experience and current responsibilities of PI and co-PI. It's very important, that where you will take help of co-PI, you can make a flow chart. And flow chart can say, step 1 done by PI1, it goes to 2, PI2, again how it comes back to PI1 for whatever purposes it comes. So make a flow chart. So at one glimpse, they would know what would be the flow of the project and what could be. They could also know what could be the bottlenecks if there are any. See, this gives. It should contain all details of how each of the objectives will be addressed. Section must be detailed, have clear plans, not vague. Don't give generalized statements. It should have several schemes. So scheme is what is like flow chart, tables, figures, equations. Of course, not always necessary. In pharma, we don't have always equations, but if you're writing some project where you're doing fabrication of equipment or any other thing, equations might come in. Whatever you are doing, justify that. Then give time schedule of activities. So generally it's done through bar diagram, or we call it as PERT diagram, right? PERT. Give that. Here they also ask what could be the environmental impact. Now that has become one very important criteria, right? Whether we are talking about carbon footprint in our project. How many pharma people do know about carbon footprint? So all the efforts are being done to, as far as possible, reduce carbon dioxide emissions, so that how your project could be useful there. Whether you're taking care of, if you're using some solvents, can you have a technology which is a green technology and you avoid those solvents? That is also they are looking at. And that's where, our Bill and Melinda Gates project, which I discussed, got actually selected because we had proposed a green technology, green one-step technology for making vaccine. Then you need to talk about expertise which is available with investigators in executing the project. So what are the professional expertise each one of collaborators has? What they have been working on? What are their preliminary results? All of that has to be highlighted. Key publications come in. Then you need to give list. Here also you should not really, no, you have to be faithful. They ask for a list of projects submitted or implemented. And right, that DBT DST gives you award. No, one project gets completed, then only next comes. So very, very carefully see that you do, because now everything is online. They can just check how many projects you already have. In fact, being on the other side, I know they give us a list. How many projects you have submitted, how many were rejected. So that is the first glimpse which you get. No, 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 meaning already they are half in a mood to reject your project. So then you have to make your project very, very strong. Personal, I told you, no, look at whether you need one manpower for each of PI and co-PIs, or you can have a shared one, right? Identify and write in the beginning, inform whomever you are selecting what will be their role and responsibilities. Many times I've seen, SRF, specifically as you grow older, you become more rigid. You'll say, I'll not do this work, I'll not do that. So let it be known to them what is expected of them. And of course, fellowship financial assistance should be in line with what are their qualifications. So if you are employing a PDF and you are giving 30,000 rupees, is not what they'll come at, right? I told you now, our Prime Minister's fellow get 93,000 per month as fellowship. So when they go to industry, they say, anyway, in academy, I was getting 12 lakhs per annum. So my salary should be more than that. So same thing is going to happen here also. So as indicated, number of personnel will govern the budget also. Discuss during the interview these role of personnel. Judge the person, not only its intellectual acumen, but also judge how as a human being that person is, whether he or she is a right kind of fit in your lab. Very important to judge those criteria. Because finally, the research depends a lot on interpersonal skills. Communication may be bad, but as a person, how the person is. And then comes tenure and budget justification. As indicated, you are putting that in per chart or by bar diagram. So at the end of each of that, what would be your milestone should be very, very clear to you. Always see that you keep some buffer time. Some instrument not working, your lines, your bar chart lines will vary. So if in the beginning itself you have kept buffer time, I told you, first year you are not able to achieve much. If you do more and present more, they'll be happy. But if you write more and do less, they will not be happy. So see that you do the timeline activity accordingly. Budget should be appropriate and necessary to execute. The PI might need some money, co-PI should be needing some money. So see that right in the beginning, this is bifurcated. Don't put it in one place. Again, the roles and responsibilities of PI and co-PI, you need to sit across the table and sort it out. If there are publications, for which publication, whose name will be first, or whether you'll be joint co-authors, or who will be corresponding, all that should be done right in the beginning. I have faced problems and so can you. So you should be very clear from the beginning whose idea it is. If you are giving the idea and the co-PI is just executing some part of the work, for that he or she has already got money, then he should not mind having, publication as a second author. But if he's done majority of, say, animal work, and the presentation, your publications are two. One depends on only formulation characterization. Second is preclinical study. So preclinical study, he can be the first author. So such things should be discussed before that. Acquire quotes in advance. Now, most of the granting agencies want you to upload. If you say, I'm asking, say, for single crystal XRD, right, and you're asking for 2 crores, say that you have a quote in advance to indicate to them really that equipment costs that high. Justify application of resources and comply with upper limit, percentage share. Institute also has share, Our institute takes 25%. So same way, all institutes have some overheads, but some granting agencies have fixed overheads. So either you have to convince your institute or you have to convince granting agency. So it's easier to convince your institute, right? Then you need to give all such list of facilities. Don't miss anything because you may not have given, but your colleague may have given. That's also there in their kitty. Then comes expected outcomes or concluding remark. And again, here you need to follow character limits. It would be a good idea to give objective wise outcomes because then they are also very clear and you are also very clear what is expected. You can list them or you can make a chart and give all the expected outcomes. And this should actually reflect completeness. And as I told you, alternate approaches or contingency planning has to be there. They will look for it. Few more tips. Read call for proposals carefully. If you have any problem, you don't understand, don't ask your colleagues. Many times you get misguided. You can ask program coordinator. Plan your proposal writing and compilation well ahead of deadline. I told you already, right? So this helps. Otherwise, generally there is jamming, right? Near the deadline, and then you may lose the opportunity. Why do that? Check the funding agency website for timely updates. Sometimes a website, tell you that timeline is it is extended. In one of our case, the deadline, they closed it earlier because they had received more than 250 projects. When we called, program coordinator said, sorry, already closed. So you don't want to be victim to this, right? For online submission, register immediately. Familiarize with submission process. Now, this is required because, many times they give you a list of documents which are desired as a PDF. But when you start filling online, you see that some more are required. So it's better that online you go on filling ABC, XYZ, whatever, no? Don't just press the submit button, but you can go on seeing what are the requirements. So that's why I said fill dummy information first, access all the sections, download whatever templates, formats are needed so that you know what is expectation. Later, you have written 1,000 word abstract and they want only 500. Then, if on last date you are submitting, how will you condense and you might lose important information. So it's better you know that format well in advance. Use PubMed, Google, PatentScope, any other tools for literature review, but see that you do a good job of it. Don't miss any of the references. You may also look at who could be potential reviewers or referees for that kind of a project. That gives you an idea. Don't miss their references, if any. If you're working on co-crystals, I know India, you know Dr. Nangia works on it, and there's no reference of Dr. Nangia. You are at a loss, right? That shouldn't happen. Outline the milestones, outcomes very, very carefully. Perform thorough grammar and spell check. This is, as I told you, writing different references, different styles every time, and writing in such a way that the third person cannot understand or grasp what you have written. They can definitely reject your proposal. I've already told you that levels of funding are at different levels. So depending on proposal, there'll be different formats. Depending on the funding to whom it is being given, there'll be different formats. But more or less, whatever I've discussed, from title to concluding remarks, words change, flow doesn't change. There are multiple rounds of proposal evaluation, DBT, DST, etc. So they may first ask you, submit a 5-slide PPT. Then they might call you to present, or they might not call you and they'll play it to the evaluators. Then they will call you. So that means you need to be ready for all times. So now I'll take some case studies from our own research lab, giving you importance. So this was a SERB core research grant. You can see individual centric. There was call for proposal, and very clearly they wrote the applicants and co-PIs should be Indian citizens. Foreign nationals are also eligible to apply, provided they fill the eligibility criteria. So PI, co-PI is acceptable. No plagiarism. See, in granting authorities also have started talking about plagiarism. So proposals submitted must be original in ideation and content. Plagiarism in any form will not be acceptable. So if that happens, they don't move forward. Directly, it will be rejected. Then they give you how to apply online. And they also give you, as I told you, documents which are required to be submitted. So these are the documents which are required as PDF. So you have to be ready with your own CV in their format, certification, endorsement letter from HOD, your head of institution. And if project is approved, the quotations, everything you have to be ready. So this is what we submitted. This is a project which I told you was between 2 institutes in Mumbai, another one in Bangalore, IVRI, that's also industry. Development and evaluation of nanocarrier-based novel foot-to-mouth disease virus vaccine for non-parenteral delivery. Very clearly, I've said that it would be for novel foot-and-mouth disease virus. It's a vaccine, and we are going to give it by non-parenteral. Now, why we didn't put specific? We've given it nasal, but if nasal doesn't work, we had to have an alternative, and therefore non-parenteral. So this definitely got approved. I told you here, manpower we asked only for 2, though 2 institutes and 1 industry were actually collaborating. Now, we got approval letter, but they asked that within 20 days we had to submit all these things. What I'm trying to tell you is that just getting approval doesn't mean that you can now, be at rest. Anytime you can get any such letter asking for, or mails. So you should not miss their mails saying, provide the quotation for equipment, give the institutional commitment letter. No, basically that 50% of the equipment grant will be borne by them. That is because IVRI had asked for something huge. So they wanted that letter. Salary structure of the project staff they wanted. certificate stating that any visit abroad for a period more than 8 weeks. Okay, you can't go without taking their permission. So all these become binding on you. Then RTGS details and so on and so forth. So within 20 days, all of this had to be provided. So what I'm trying to say is, it is not done till it is done. When in sanction it's come, we start celebrating. But if you can't do this in 20 days, your opportunity is lost. This is Bill and Melinda Gates Foundation project. This we had written under One Health concept. One Health means solution is beneficial both to humans and also animals. So there was an opportunity because they had asked for proposals under One Health. So after I read that, believe me, at that time I didn't know what One Health concept was. I read what is meant by One Health. And then we looked at what diseases are common for animals and human beings. And then we zeroed it on brucellosis. So when you look at the diseases, all this is given in their website, okay, when the call for proposal was there. So they indicated that you could work on all these diseases which are indicated here. I zeroed it on brucellosis because I knew tuberculosis many will write. And why brucellosis? Because India has a lot of, basically big animals. Generally, this disease affects cows and they need to be slaughtered if they get infected with brucellosis. And we know our religion has a lot of respect for cows. So here, what was very important is we had to pay attention to details which are given in the project, and we had to give a very crisp rationale. They indicated that you can collaborate. So in this case, we collaborated with Mumbai Veterinary College. Why Mumbai Veterinary College? Because what we were writing, they had extracted already antigen. And that also we came to know through literature, sir. So how can we move fast forward? If this is for 18 months, I can't possibly extract, characterize, then encapsulate it, make a vaccine, and then go ahead. So we collaborated in this case. Title was Nano Vaccine for Brucellosis using green technology. I told you, right? Nano vaccine, brucellosis, green technology. And this, I think, gave us an edge because we indicated we'll be using supercritical technology, which does not use any of the solvents to make nano vaccine for One Health concept, brucellosis. So today also, if you go and see, BMG, our name is there. That gives us sort of a satisfaction that, yes, the proposal came through. And best part is if this BMG proposal comes through, right? This is you've given proof of concept. Next time when there's a call for same One Health concept and I apply because I have proof of concept, I can get 100 million US dollars. Imagine. So we are waiting for that grant because the initial results are really, really very, very good. And it's not biased because most of the studies, unfortunately, we had to give 2/3 of the money back to US. Why? Because we didn't have class 3 facilities here to do. Brucellosis is an infectious disease. So we had to do it in US in one of the universities. And we have the results as well as the publications on the same. So that gives us leverage that, yes, the next time the project call comes, we'll be benefiting. Many times I told you that granting agencies ask for presentation and they'll give you, what is needed in the presentation. So aim, rational, whatever preliminary data is available. This was during COVID time. And for what funding is being requested. Eligibility criteria and this budget. That's all. Imagine in these many slides, they say number of slides is fixed, okay? 4 to 5. You have to fit what whatever project you have written. So because we had worked on brucellosis, same technology we thought could work for COVID. So we gave preliminary data of brucellosis to say that we could make intranasal mucosal vaccine for COVID-19 infection. So letter of intent had to give primary information. Review meeting, they used to call, no, the committee is meeting and they'll call that you join now. Very odd hours, but whenever they call, no, full day will be waiting. They'll tell you, which day. But then your turn, whenever your turn comes, you need to log in, answer to their queries, and log out. So then they ask for all the quotation, ethical clearances, if any, bank details, some checklist, if they have any. Pre-award, you need to identify funding agencies, prepare proposals, submit the proposals, and you get award acceptance. But your work doesn't stop here. That's what I was trying to say. Post award, you have to do financial distribution. You have to do monitoring and reporting activities. For example, now we have monitoring of proposal by this committee for Rajiv Gandhi Science and Technology proposal. So 1 year goes, they would like to know what you have worked on, whether you're working as per timeline, whether you need some hand holding, whether you need say instruments which you're not able to procure or work anywhere else. They will do hand holding. Idea is that they want to see again that the product goes in market. And it is your work is not completed till you submit project completion report and you get one liner from those agencies that project is completed. So when pre-award stage, you need to read and critique your proposal from reviewer's eye before submission, right? So if you have any colleague or someone who can review it for you, it would be good, because many times you tend to miss certain points. The post-award, understand the reviewer's comments. Even if it gets rejected, you don't get dejected. It's a learning experience. Work constructively around the grant. You can always resubmit the grant, taking into consideration the comments. So this is just, I think I'm coming to the end of the presentation. We started with one beaker and magnetic stirrer. And through these grants in our lab, we have generated almost everything which is necessary. Within the lab, we have Zeta Sizer, we have Beckman, ultracentrifuge, we have USP2, USP4, we have Francel, we have Rotavap, behind which what you can see is a cell culture lab, which we generated using Bill Melinda Gates grant. We have UV, we have IR, we have spray dryer, we have freeze dryer, and n number of things. And that was only possible because we wrote proposals, we worked on it, and we translated technology. So these are some of the technologies which have gone from our lab, to the market. We worked on stents, as was told in my introduction. We worked on intrauterine devices. We worked on certain nano systems, worked with many big companies, many small companies too, and seen that our products have gone. Why is that possible? That is given in this slide. All of my research students have to read this loudly when they join. And if they lose the path, I again make them read this. This just means focus. Once you have taken up an idea, see that you focus only on that idea. Leave every other idea alone. Now, many times, students feel that this is not working, let me try that. If this is not working, let me try that. That shouldn't happen. Why it is not working? Find answer to that. Then move to the next if need arises, but first find answers. So always remember, dear friends, secret to getting ahead is getting started. So Mark Twain said it, but I sincerely follow it. Unless you get started, you'll reach nowhere. So with that, thanks once again to the organizers for giving me this opportunity. And I hope some things which I have told would definitely will have take home value.
I'm also. Uh, Thank you, ma'am. I can see there are lots of overwhelming message, great session from the different audience in the chat box. Ma'am, you can also see in the chat box that people are really happy to get this kind of useful information regarding this proposal writing and trend. Now I like to hand over the mic to Dr. Annu. Yeah, just one second. Yes, Dr. Annu, ma'am, please, you can unmute and go ahead. Dr. Annu, am I audible to you, Dr. Annu? I think you get muted. Anyway, ma'am, so this is really very insightful session. Each and every slide is really very, very useful for all the audience. Now, I like to take quickly some questions from the audience.
Sure.
Yeah, Anu ma'am, Anu ma'am, you're there? You get muted.
Yes,
Yes, Anu ma'am, it's over to you.
I'm
Please.
here.
Yes, Anu ma'am, go ahead. I think there are some
Okay,
internet.
thank you, sir. Thank you so much, Vandana ma'am, for your
I can't hear her.
Yeah, actually some network issue, I believe. Anu ma'am, please go where the net connection is available because your voice is not we are getting.
Maybe they can unmute them and ask, if they haven't.
Yeah.
I can see some hands raised. Sushil
Yes.
Pawar, but he has to be unmuted, right?
Yes, I'm going to unmute. So yes, quickly I will take some questions from the audience. So Dr. Sushil Pawar, please unmute. You can ask directly question to ma'am. Dr. Sushil Pawar, please unmute.
Good afternoon, ma'am.
Good afternoon.
Yeah, how are you, ma'am? Fine.
Always fine.
Yeah, madam. I have just completed my PG in one department. I am planning and doing the second PG in the cognosy.
Okay.
So I am interested in doing a PhD. So actually I don't have any idea about doing PhD. I want your guideline.
You have done your master's in which branch?
QA, quality assurance.
Quality assurance. Okay.
And I am doing a second PG in pharmacognosy.
Pharma?
Cognosy.
Okay.
Yeah. So after this on pharmacognosy, I want to do a PhD.
Yeah, so you will have to make up your mind whether pharmacognosy really is good for you. Definitely, what is the purpose, whether you want to be in teaching or whether you want to go to industry after this. So that's the
No, I
first
want to be in
thing.
teaching.
You want to be in teaching only, right? So
Yeah.
pharmacognosy, the way things are going on, again it has made a comeback, and rightly so, because our traditional wealth is so very rich, and it is remaining unexplored. So definitely, with your background of QA, where you've learned probably the instrumentation techniques, you will be able to standardize these herbal moieties and even herbal formulations if you take up in pharmacognosy. So you can do the best, in your PhD, and identify, the phytopharmaceuticals mode, which our government of India is giving importance to now. Phytopharmaceuticals, where you take 4 biomarkers for a particular plant, right? And then
Yes.
move ahead, standardizing it, making the formulation. So maybe you can take that as a project work for your PhD and move ahead. And for PhD, definitely, as a faculty, you are a faculty right now somewhere?
Yes, madam.
You are faculty. So faculty has grants, if you are for 2 years permanent faculty in any place, even ICT gives you a chance. So likewise, there are so
Okay.
many universities giving you, giving teachers a chance to better their qualification. Another way is writing PACE project, no, PACE. Maybe later you can Google it, wherein if you have an idea, you can do it in your own place, wherever you get a research guide. But for 3 months in the vacation period, you can go to government institutes of repute and do your work
Okay.
there. So that option is
Okay.
also available. I think any of these things you can do.
Oh, thanks, ma'am. Thanks a lot.
Okay, thank you, ma'am. Now I can see Dr. Sujit Nagare. Dr. Sujit, please unmute. You can ask questions related to ma'am. Dr. Sujit.
Hello, am I audible?
Yes, yes, yes.
Yeah. My question is to Dr. Patravale, madam, that whether are there any opportunities available in surgical implant-based research and proposals are like being invited from the government side or any agency side, so we can address the problems are related to surgical implant industry.
So definitely, no granting agency segregates medical devices from any other research pharma people are doing. So throughout the year, submissions are being invited under that. Right now, I don't see any specific call for proposal for that, but our, what to say, DCGI has understood the importance of medical devices, which are implantable devices, and only guideline has just come in, last 6 months a guideline has come in. So probably till then I think you should go through the guideline, and what you can do is work with the industry, hand in hand, and that's how in fact we could do stents, and the journey continued. 1997 we started working on stents. 2005 we put first stent in market, but from 2005 to 25, right, in 20 years, 8 products, improvised products, have gone in market. So when we talk on stents, for example, we are working on the platform. So first is a stent as a platform, which is metallic. It could be metallic, it could be made up of biodegradable material, or it could be metal and biodegradable material. Then we talk about drug polymer coating. So obviously, drug changes, polymer changes, we modulate the release. So at that front also we are working. And then we started working, starting from microspheres, we started working on nano and coating these nanos on all kind of medical devices. So I think there are many kind of medical devices, as you know, type 1 to 4. So which area would you like to work? Which are the industries who are working in that area, and what you have, what is your expertise which you can offer to them? If that is very clear, please approach. Even if government grants are not there, talk to industry, get projects from them, work with them, and see that your products will go to market. They'll give you your own share. What I see in this case is now last 25 years, I'm consultant to them, right? So any small problem, they'll come to me, which gives satisfaction. And when you see your products rolling out, last one which I heard from them is we had quoted, balloons, and they've also passed. So very soon we'll see those also in the market, and not only Indian market, it goes to different countries. So please work. If there are no calls from government, see that you start working with industry. What stops you? start working also with NGOs, no, non-government organizations who might want. For example, when we worked with anti-AIDS formula, it was a gel. And gel administration into rectum is a big task, no? It was a rectal microbicide. So for homosexuals, basically. And that population was on rise, and there was no call, but we worked. We said everyone will work on vaginal microbicide. Why not work? That's how you need to work differently. Why not work on rectal microbicide? So we had designed the kind of a device like your Vicks inhaler, so that it can administer gel into the rectal cavity. And there we had to work with NGO. So why not work with all these people and to see that first see your products rolling, don't think that I'll get huge money. That is not the purpose. First see the products. They should be useful for the end user. That's your patients.
Thank you, ma'am. So there are two more questions I can see. Dr. Vishwajit Sonwane. You can please unmute. Dr. Vishwajit.
Hello.
Yes,
Yes.
Dr.
Good morning, ma'am. Good morning, sir. I have not completed my PhD yet, so I've, it would be nice if you call me as Mr. Vishwajit. So now,
No, it's okay. We have given you honorary degree. So Dr.
thank you, thank you. Ma'am, my question is during your PowerPoint presentation, you were talking about for writing a research grant, there are certain factors which need to be considered. So like research hypothesis, need for manpower, and there is one factor that is availability of resources. So could you please elaborate on it once again?
Yeah,
Availability of resources.
So availability of resources are availability of facilities which already exist in your institute and in COPI's
Okay.
institute, because they need to be
Okay.
listed down, list of facilities.
Okay. So what are the what facilities?
Instruments, equipments,
Okay.
infrastructure.
Okay.
Yeah. Whether
Infrastructure.
you have an
Okay.
animal house, right? If you're proposing something which requires animal testing and your COPI doesn't have it, you also don't have it. So are you going to outsource that? So that should be very clear. They'll look at those. You ask for animal experimentation, but you've not asked for any funding for it. So there will be a question, right? So that way. So
Okay.
list all the facilities and equipment and infrastructure.
Okay. Okay. And also, ma'am, one more question is, what is your take on research grants in the area of neuroscience?
Neuro.
Neuroscience, yes.
Yeah, definitely. That's a growing field, and no, our aging population goes on increasing. All over the world, that is increasing. So, in fact, 1 in 5 chance of getting Alzheimer, imagine that by 2030, which is, and with all these digital things increasing, I don't know what is going to happen. So, I feel there is a dire need. So, that area is growing.
Okay. Okay. Thank you, ma'am. It was really a good session and lot of new things I got to learn from you, ma'am. Thank you so much.
Thank you.
Ma'am, in chat box, I can see one message on Dr. from Rohit Shah, that how to obtain this DSIR certificate in research lab for funding agency.
So, in fact, DSIR gives, basically subsidy to industry. So, why for the research lab you would need? My question is that, if you can answer that. For a research lab, why do you need a DSIR certificate?
Basically, what he is asking to get, because some of the funding agency, they are asking for DSIR certificate, whether it's available in your research lab or not. So I think based on that, he has narrated this question, how to obtain DSIR certificate.
I'm sure, you can contact Dr. Ranjit Bhairava, maybe if you can Google him, and he's in DSIR. In fact, he was our ICT student, and check for formalities to be done at that level. But we never had that I mean, ICR doesn't have a DSR certificate, still we are doing research. So I don't know. Sorry if I'm not able to answer, but you can check. I'm sure DSR website also would have. Maybe the kind of project you actually propose needed that. So please check once again.
Yeah, Dr. Bhushan, last two questions we'll take quickly. Dr. Bhushan,
Yes, sir. Yeah, yes, sir. Yes, sir. Actually, madam, I want to ask that what are the requirements of the clinical studies that are carried out in the academic institutes? Is there any importance for the technology transfer of such a clinical trials? And another one is that how to contact the industries for the technology transfer? Thank you, ma'am.
Clinical trials first should not be done in academic institutes. It is very clear because they require special facilities, right? Preclinical, up to animal work, you can do it in institutes, but clinical trials have to be done in hospitals or in the contract research organizations. And second question is tech transfer, how to go about doing it. It's a separate lecture altogether. But in a nutshell, yes, when you're ready with your prototype, what you can do is without giving the technology details, you can give the results of that particular prototype and circulate it to all the industry which might be interested. So before, in fact, this should be done before starting the proposal. It's not that once you have a good thing in hand, you start running around. So right in the beginning, you should know who would be the stakeholders who would be interested in your technology, approach them and see that, you have used the materials which are approved by US FDA, or maybe they are listed in Orange Book, if you're working in, say, formulations, or at least they are GRAS listed, and do a very systematic development of the product. Then only tech transfer is possible. Otherwise, there will be gap. So you can approach small industry, you can approach medium scale, you can approach big pharma if you have done a very systematic study, and that systematic study says that you have utilized equipment, instruments which are 21 CFR compliant. How many institutes have 21 CFR compliant instruments? That becomes a bottleneck.
yes, the last question I can take from Dr. Avinash. Dr. Avinash, please unmute.
Yeah, thank you very much. Good morning, ma'am. I'm Dr. Avinash Tekade from Marathwada Mitra Mandal College of Pharmacy, Pune. My question is, like before asking a question, let me tell you, it's been a wonderful experience listening to you, and every time I heard you, I learn a lot from your sessions. Thank you for that. Now my question is, ma'am, that we got grants for development of one of the product and for carrying out a preclinical testing, and now we have successfully completed it and submitted to the funding agencies, and again go for the second phase. We asked for the second phase grant for carrying out a clinical trial. Uh, so then they said like you should approach the. We have submitted the proposal from the private clinical trials, their organizations, but now the funding agency asked that you should approach the government agencies and get the clinical trials carried out in government setup, government hospital. So we tried to approach, but then it is very difficult to get the permission from this government hospital and all for carrying out clinical trials. So what to do in this case?
Meaning, if you are open, maybe you can be in talks with KM Hospital in Mumbai. They definitely
Yeah.
promote, academia and this type of a partnership. KEM Hospital in Mumbai.
Yeah.
So, because we know we had approached for anti-malarial trials, and the thing is that you have to have people who understand what is your proposal like, and they work hand in hand with you to set total clinical protocol. So, yeah, now if it is DBT and other parties, they would want AIMS to do it. Why others? It's like funding going from one body to again coming in government pocket. You're getting that, right?
Yeah.
So
Actually.
if you get hold of some AIMS or such institutes, it would be better.
Okay. Okay, madam. Thank you very much, madam. It's always been a great experience listening to you.
Thank you so
Thank
much.
you. Thank you very much.
There are some questions in chat box. If the title is same, that means it's plagiarized, right? So obviously you have to come out with a different title always. Dr. Mirza asked how to get fund for conference symposium, or is the question different? May I ask question regarding to get fund for conference symposium? You can write to all the funding agencies have that grant, in fact. If you go to even DST site, there's a separate portal for conference and symposium. If you want to do international, I have already told you, you need to partner with one coordinator from their countries who will get the people.
Due to shortage of time, we are not taking any more questions. Now we will wrap up our sessions. Thank you, Dr. Vandana Patravale ma'am, for your such a wonderful and insightful sessions. I have highlighted some key points that you have conventionally and very efficiently explained, like how to write the grants, how you can prepare your eye-catchy titles and other types of proposals in a grant. Thank you, ma'am. Now, please accept this certificate of appreciation letter from Sardar Patel College of Pharmacy and Gujarat Technological University as a token of gratitude and recognition of your invaluable contribution. Now, participants, kindly fill your attendance and feedback form. Thank you so much, ma'am.
Thank you.
Kindly accept the certificate of appreciation from Sardar Patel College of Pharmacy and Gujarat Technological University as a token of gratitude and recognition of your invaluable contribution to our college.
Thank you, Doctor.
Thank you, ma'am, for accepting our invitation and for this wonderful session. Now, I like to ask all the audience, kindly please turn on your camera. We will take one group photo, a screenshot with ma'am. I request all the participants, kindly please turn on your camera. Yes. So I'm going to take some screenshot. And one thing I have seen that more than 460 continuously audience are listening to ma'am. So more than 460 at a time, they are listening to ma'am without any um, disturbance. They are continuously listening to ma'am and learn a lot, I believe. And I can see the kind of comments in the chat box. They are really learned and they are very happy to listen to Vandana ma'am.
Thank you. It's really pleasure getting connected to youngsters. I am always there for you. I put my phone number in the chat box, so please feel free if you have any questions, you can ask later also. Thank you. Thank you so much, Dr. Savir.
Thank you, ma'am. Ma'am, please share your PPT. Most of us are asking for participants asking for PPT. You can share your PPT so that I can share with them later on.
Sure. I do.
Yeah.
Thank you.
Okay, ma'am.
Can
Thank
I
you, ma'am.
do?
Yes,
Yeah.
yes, ma'am. Yes.
Thank you.
Now, audience, I'm going to share the feedback form in the chat box. Now you can fill it and then you can leave. Just wait. I'm going to share the feedback form. So in the chat box, I have shared the feedback link. So kindly fill this. I request all the participants kindly fill the feedback form, which is already shared in the chat box. After filling the form, you can leave the session. Hope everyone is joined in the WhatsApp group. If it is not yet, you can please join because we are going to update everything in the WhatsApp group. And in your email, you may get received email from SPCP events. The email what we used to send you the details of your WhatsApp joining link as well as other details. It is from SPCP events dot pharmacy at the rate spec.edu.in. So from that email, you have received the confirmation email as well as the link for join to WhatsApp group. So kindly check your mail in inbox as well as our spam email so that you can join in the WhatsApp group. So I repeat again. So the feedback form is already shared in the WhatsApp group as well, even in the chat box, Zoom chat box. Please fill it and you can leave the sessions.